Hi everyone, thank you for joining with us today. We're just going to wait a few more moments for a few more folks to sign on. Thanks. Hi everyone, welcome to the TBR Webinar series. Today, Senior Analyst John Caucis will be discussing enabling stakeholders across the healthcare ecosystem to navigate the path to value-based care. Before we get started, a few housekeeping notes. At the bottom of your screens, you can access the slides, audio controls, Q&A, speaker bios, and our survey. After the webinar, you will receive an email with a replay link, as well as a link to view and register for other TBR webinars. If you have any questions for us, please submit them via the Q&A widget in On24. You may also reach out to us after the event at webinars@tbri.com. Thank you again for joining us, and here's John to begin the webinar.
All right, thank you very much, and thanks everyone for joining us today. And welcome to our review of the Healthcare IT Services Benchmark, our most recent benchmark that published back in mid-January, covering the third calendar quarter of 2008. I understand that that sounds a bit dated, but we are beholden to the earnings cycle for the companies that we cover, and as such, that's generally how the data flows. And we're currently in the process of finalizing the tabulation of some of the 4Q data that's come in. But today, for the purposes today, I'll be talking about the key takeaways and results from our most recent benchmark. My name is John Caucis. I'm the lead analyst in the healthcare IT services practice here at TBR, and I will be the presenter for today's session. And just a bit of background information on our healthcare IT services research program. Our focus within this market, within the health IT and IT services market, is to provide a view of the market as we term it, viewed through the company, through a company-centric lens. In essence, what we do is we develop our view of the marketplace by tracking and analyzing the activities of companies that operate in this space. In this particular sector, 20 companies operating within the realm of healthcare IT services. We collect quantitative as well as qualitative information on these companies. We do so on a quarterly basis. This information provides insights into their strategies, strategic actions, or key developments that occur during the quarter, things like alliances and acquisitions that they make, and then generally their overall fiscal and business line performance. So as I mentioned today, I'll be summarizing the results from our last Healthcare IT Services Benchmark, which published in January and covered the third calendar quarter of 2018. Do look forward to receiving your feedback and responding to questions that you may have about the information that I cover today. So What are we going to discuss today? Essentially 3 topic areas. First, I'll provide an overview of the market based on the data from our most recent benchmark report. Then I'm going to drill down a bit into the individual vendors a bit more specifically and discuss how the key market dynamics influence their fiscal performance. And it's mostly around growth and profitability. And then finally, I'll have some comments on our outlook for the healthcare IT services market, as well as some reaction to the HIMSS conference that happened in Orlando, Florida last month. So I'll take a moment to orient you to the illustration here. The darkest shaded green line, the uppermost line on the graphic, illustrates the average total year-to-year growth for healthcare IT services operations of the companies in our benchmark study. The next darkest green line is similar. It's also an average year-to-year revenue growth, but we weight the data here to account for the size of each benchmark company's respective revenue base in healthcare IT services, and we calculate that on a trailing 12-month basis. This was mostly done to kind of smooth out seasonal forces as well as the impact of acquisitions. The next line down represents the data from TBR's Global IT Services Benchmark Program, and we provide this to offer a comparative view of the larger IT services market against the smaller healthcare vertical and how one is driving. And healthcare has certainly been driving the growth in the overall IT and IT services market globally, most certainly here in the U.S. for some time. And then finally, the last line on the graphic is plots average organic year-to-year revenue growth, and it represents the growth net of the impact of any acquisitions over the last 12 months. In addition to that, we've provided our outlook projections for the upcoming fourth calendar quarter of 2018. And I can say with some certainty at this point, having tabulated a good portion of the data that has come in and that we've analyzed thus far for the fourth quarter, that the trend lines that you see here, with the exception of the overall IT services markets, I need to confer with the lead analyst in that practice area to get a better sense of where that market is headed. But within the healthcare market, the trend lines that you see here are more than likely going to continue, and we're going to end up almost exactly where we had projected last quarter. So what's driving the growth that you see here over the last year or so, really driven by acquisitions, and acquisitions by a minority of healthcare IT services vendors, acquisitions that happened predominantly in the latter parts of 2017 and the early parts of 2018, really drove the acceleration in growth that characterized 2018 Although I will note that the overall pace of M&A activity within the healthcare IT services market has been trending downward, and it has been somewhat subdued in comparison to what we had seen in prior years, especially 2015 and 16. Large strategic acquisitions during that time, IBM and Truven, Cognizant, TriZetto. We haven't seen anything, we haven't seen the pace, the number of acquisitions of that magnitude now. The overall volume of M&A activity has declined, at least within the sphere of companies that we track, even though there is and continues to be a large influx of investment capital flowing into the space. Within the group of companies that we track, we've seen the overall pace of M&A activity decline. However, that large spike that you see for the total growth rates in the second quarter, that kind of diminished a bit as we went into third quarter. That was really driven by one company in our benchmark, that being General Dynamics. They acquired CSRA back in I believe the first or second quarter of last year. So the impact of that really started to hit our benchmark, and given that it is a small slice of the market, it did create a kind of an General Dynamics was really overrepresented from an inorganic growth standpoint because of that one acquisition. But there were others as well that are driving the growth here. Allscripts made a number of acquisitions, including the Enterprise Information Solutions Group from McKesson, a couple companies called Practice Fusion and HealthGrid. Cognizant has remained fairly acquisitive, buying top-tier consulting, TMG Health, and of course Boulder Healthcare Solutions, and all of that happened in the aforementioned late 2017, early 2018 period, where they provided significant inorganic contributions. Atos has been acquisitive as well. They've been integrating the assets that they acquired from Conduit, the healthcare provider, and the Breakaway Group, as well as Pursuit Healthcare Advisors. That's been factored in here. A bit later to the game, and this actually happened in the third calendar quarter, was DXC's acquisition of Molina Healthcare. That hasn't begun to hit yet. I believe that the impact is going to be mostly in the fourth calendar quarter data that we're currently compiling, and that was factored into our projection for the 4Q growth rate that we've illustrated here. However, I do want to note that I want to direct your attention to the average organic growth rate illustrated here, which was about 2.7% in 3Q versus the 11 plus total growth rate and 7 plus total growth rate on a trailing 12-month basis. And we looked at that data as perhaps an indication that there were some unforeseen headwinds building in the marketplace. And I can tell you once again, having taken a preliminary look at the 4Q data, we're starting to see some of that come out as well. And a lot of it began really in the second and third calendar quarters of 2018. First of all, the regulatory-driven investment patterns stemming from meaningful use really begun to diminish. Ehr adoptions in the U.S. has peaked. I think the last numbers that I've heard are that somewhere in the neighborhood of 90 to 95% of all provider organizations in the U.S., irrespective of size, have some sort of EHR in place. There's still a fairly active market for EHR swaps and replacements, and certainly outside the U.S., there's a lot of white space that the companies we track are capitalizing upon. But absent a significant regulatory factor driving health IT investment, as that has diminished, I really think that especially provider organizations have kind of taken a step back and become more introspective in terms of where they are when they're crafting their IT budgets and their IT investment strategies. This has been less so the case in the U.S.-based health insurance market, where we've seen lingering turbulence around the uncertain future of the Affordable Care Act. Stable is the market there. The payer market in the U.S. is stabilizing, but there are still some headwinds that the vendors that we track have noted. We saw a divergence really in booking trends across the companies that we track, but one common theme that came through is that now there's ROI is the new normal. ROI-driven demand is really the new normal in health IT procurement, and this has somewhat tempered the demand for next-generation solutions. Sales cycles have been dragged out. Booking trends reported both in the third calendar quarter as well as in the fourth quarter, what I've seen thus far through our preliminary analysis suggests that demand will improve for the more advanced technologies, but it may take a bit longer to really crystallize than the companies had originally anticipated. In terms of portfolios, the companies we track are continuing to make investments though in these areas. They're fairly confident that these investments will pay off, though the time frame may be a bit uncertain at this time. The folks in our benchmark who are more systems integration centric, partners of the EHR centric vendors like Cerner and Allscripts and Epic, and especially those integrators that have strong health domain capabilities, have been uncovering opportunities to provide advisory services, guidance services for healthcare organizations as value-based care becomes imminent. More immediate, I should say. There's still some uncertainty about the timing of that, and everybody seems to be on a slightly different maturity curve in terms of their readiness, what they've implemented thus far, what technology, data-driven tools they've implemented to move in a value-based direction. So what I'm going to do now is move on to the next slide, where we'll talk in more depth about some of the leaders and in terms of growth and profitability. And I'll take a moment to orient everyone to the graphic here. What we illustrate here are the 20 companies, absent General Dynamics. Their growth because of the CSRA acquisition is off the board still, and it will be for another couple of quarters. So we have to kind of put a disclaimer on the graphic indicating where they would lie, but unfortunately, to make the graphic readable, we weren't able to include that actual data. So other than General Dynamics, the companies here, the illustration shows their relative positioning against one another in terms of top-line growth, in terms of margin performance, and this is, of course, around healthcare IT services and their revenue base in healthcare IT services. And basically the story here is which companies are growing the most rapidly and which are doing so the most profitably. On the x-axis, we illustrate absolute dollar growth of each vendor's healthcare IT services revenue base. On the y-axis, we illustrate the reported, or in many cases, estimated operating margin for each of the companies. And then size of the bubble is the actual volume of revenue generated through the quarter in healthcare IT services sales. So, and then to provide some additional context, we plotted the average trailing 12-month growth with the vertical dashed line, which was 7.1% during the third calendar quarter, and looks like it's going to pull back a bit, kind of consistent with the aforementioned headwinds that I referenced a few moments ago. And then we also plot the average operating margin performance, which is actually trending upward from the 12.1% that you see here. If memory serves me correctly, it's looking like that figure is going to be in the 12.4 to 12.6% range for 4Q. So, and that's consistent with what we've seen. The runoff of acquisition costs for the companies that have been more acquisitive, the traction with higher margin, more lucrative solutions up the stack from the EHR foundation as they begin to be incorporated, and as the companies get better selling these things, there's been some restructuring. Companies have had to, companies that have been geared from a business development and a go-to-market standpoint, that companies that have been geared towards selling and implementing EHR systems are now having to kind of reinvent themselves from a sales and marketing and from an operations standpoint, as the market moves towards, as I mentioned, those solutions up the stack towards cloud-based solutions. So some of that, there was some initial cost associated with that that's still in place, but it's being offset by the fact that many of these solutions are more lucrative, less resource intensive in some cases, cloud-based, more offshore delivery, or lower cost onshore delivery. So in terms of the growth and margin leaders, and I'm for the sake of time, I'm not going to dive in too deep, and actually not going to dive in at all on the companies that are in the laggard areas of the graphic. Happy to take questions or follow up with questions after today's webinar. But the leaders, beginning with growth, revenue growth, the leaders were General Dynamics. Certainly, we've mentioned them already. Allscripts, Atos, HCLT, and TCS. Acquisitions being a common factor of growth across most of the leaders, with the exception of TCS. Atos really effectively deriving growth from the U.S.-based assets that it acquired in 2017. They have seen an uptick in security-related work with health clients in France and Benelux and the Nordic regions. I think a lot of that is related to their recent alliance with Merlin International. HCLT made an acquisition, the acquisition of C3I, that has been providing an inorganic lift to their healthcare IT services revenue, particularly around digital analytics, IT modernization solutions. TCS is really the exception to the rule here in terms of acquisitions, because they had up until the fourth calendar quarter of last year, TCS hadn't acquired anyone in any context since 2014. They made two very small acquisitions in November of last year, not really going to move the revenue needle for them or the growth needle for them very much, and they weren't healthcare specific. But where TCS has been gaining traction is in AI-based offerings and IoT offerings around patient engagement, mostly, that continue to drive, in fact, double-digit growth for TCS in mostly the life sciences space. But they are getting they do have a sizable practice in the insurance sector as well. It's kind of their bread and butter. Not so much in the provider segment. So it's mostly life sciences and with some revenue from the payer side. So I'll also mention a couple of other vendors, particularly Accenture. They didn't make the top 5, but they have been a growth leader in our benchmark for some time. But they were knocked out of the top 5 this quarter, noting that they are starting to see some softness in the U.S. federal sector, and this was before the 35-day government shutdown, which did have a more significant, although not as significant as expected, impact in the upcoming quarter, in the fourth calendar quarter of the year. But their growth remains strong enough outside of the U.S. In their reported Europe and growth market segments to enable them to sustain one of the higher rates of HITS revenue expansion, healthcare IT services revenue expansion in our benchmark. So those are the growth leaders, the margin leaders in rank order during the quarter: Infosys, TCS, Cerner, HCLT, and CPSI. The common thread there being improved efficiencies in solution delivery, growing adoption of higher margin offerings, common across the leaders here. Infosys continues to roll out more automation in project management and service delivery, offsetting more onshore labor use and new marketing outlays. TCS, a similar story, higher value offerings, gaining traction with higher value offerings. They've completed their restructuring process. It has actually driven their overall margins back up to their target range of 26 to 28%, corporate level operating margins. But double-digit growth in their healthcare IT services sector has certainly enabled them to be one of the margin leaders in our benchmark as well. Cerner, always one of the margin leaders in our benchmark, at least for the last year or two. Strong growth in areas such as professional managed services. There was an uptick in non-cash related expenses, and they have been making more sales and marketing investments. But the growth in these more lucrative solution areas, RevWorks and ITWorks units, for example, helped to offset some of that. HCLT, despite the size of the integration of C3I, accelerating adoption of their digital analytics suite for primarily the life sciences space is helping them to generate strong margin performance. And then finally, CPSI they've been improving margins through more of more tighter controls on their travel and SG&A costs, and greater efficiencies across solution delivery in order to boost their margins. They've been engaged in some restructuring. So one other company that I'll mention as a margin leader is Epic. Of course, they don't report anything. Over the years, we've received some guidance, and we're fairly confident that because of strong contract delivery processes and their premium pricing for their solutions, it enables them to be one of the stronger performing companies in our benchmark from a margin perspective. They have been making some investments to their campus in Wisconsin, sales and marketing, rolling out new solutions, rolling out scaled down versions of their flagship EHR systems. That has created some margin pressures, we're assuming, but they still do remain one of the leaders in our benchmark. So with that, I'll move to our outlook, and we do see continued growth, steady growth for the foreseeable future, all the way out to 2025. As I mentioned, the U.S. EHR market essentially saturated at this point, so now the view is shifting up the stack. Revenue cycle solutions. Many of the vendors that we track expect that to be a more slowly developing opportunity area during 2019, but still it's where the future is for many of them in terms of growth. Revenue cycle solution contracts, or contracts that include those solutions, have become more complex, more multi-service in scope and composition. The vendors we track also seeking and finding new avenues of growth in consumer and patient engagement, certainly AI and analytics, automation, population health management, areas where the bulk of the growth and growth activity is expected to be in 2019. We also see the competition outside the U.S. heating up in 2019. The most active companies in our benchmark being Accenture and Allscripts. Cerner has been very active outside the U.S. We're starting to see Epic. We're starting to hear their name come up more and more often outside the U.S. IBM certainly looking to the markets in Asia, particularly for new growth opportunities. The EHR replacement market in the U.S. is kind of in cruise control mode right now. Still some opportunities there, but the biggest opportunity for new EHR implementation certainly remains outside the U.S. The more mature economies in Asia Pacific and areas in Europe, the Nordics I'd mentioned already, Benelux. Some EHR activity, some increase expected in the UK, the NHS making new investments to modernize their health IT infrastructure. So further out on the horizon, the fiscal benefits, and this is mostly margin-wise of growth initiatives that the vendors we track have made in population health. They too have been a bit slower to develop and a bit limited in their contribution to growth and profitability, but there is generally a consensus, and this was, and maybe this is a good segue into my comments on HIMSS, because this was something that came up during the HIMSS conference last month as well. There's a consensus that this is going to be an area of significant growth. Many of the companies that we track are prospecting with their clients right now to ensure that the clients are at least familiar with what the vendor's capabilities are, so that down the road, in probably a 2 to 3 year time frame, these investments, investments familiarizing clients with their capabilities in population health and expanding solutions and getting those solutions more deeply integrated, interwoven into their other health IT offerings, will begin to yield gains. So with that, a couple of thoughts on what happened in Orlando last month. Really set the tone for the week. The announcement from Change Healthcare, not a company that we currently track. We probably will start tracking them if they do. There's been talk that they're going to IPO after they acquired the assets from, I believe they acquired some of either McKesson's or Allscripts assets. Forgive me if I'm incorrect on that, but I know that they did incorporate some acquired assets to expand. And then there was talk at the same time that they would IPO but that hasn't happened yet. If that does, we will start tracking them. But we were certainly aware of them, and they made themselves front and center when they announced that they were, at HIMSS, that they were launching a new solution to provide free clinical data interoperability services on the AWS platform. I believe this was, if memory serves me correctly, first thing in the morning on the Monday of the conference week. Really kind of set the tone. Really reflects the persistent challenges of interoperability and consumer centrism. And the theme of interoperability, once again, this is, granted, this was only my fourth time at HIMSS, but the theme of interoperability came out and it was really front and center once again. Last year, I spoke to a few folks who indicated that the time frame for achieving more ubiquitous interoperability could be as far as 10 to 15 years out, but nobody really knows yet. Progress is being made on kind of an incremental level, but interoperability remains a big challenge. This year, reflecting that, the HIMSS Interoperability Showcase, a lot of attention. It was one of the highest traffic areas on the exhibition floor, according to the organizers of the event. A lot of panel discussions, presentations, a few that I was able to attend, talking about the nationalization of efforts on the part of the Care Quality and Commonwealth Alliances, nationalizing an infrastructure backbone of sorts to support and enhance interoperability across the industry. Open APIs got a lot of attention, the topic area around application programming interfaces, a lot of questions on behalf of clinicians, and this is a good transition to the next thing that the next observation about this year's conference. This was really, for me, more so than in prior years, show me, don't tell me. The questions, the focus of the questions, especially on behalf of clinicians, they love the flashy presentations, and the hype is always going to be there, but they want strategies, they want use cases, they want to see how these advanced solutions are being implemented, and more importantly, how they're delivering a return on that investment. Once again, going back to the whole issue around an ROI-driven demand environment. So that's put a lot of pressure on the vendors that we track to demonstrate, real-world, material, tangible results, clearly showing how they improve care access and diminish disparities in care delivery. IT-enabled healthcare, patient engagement, even consumer-centric approaches, not necessarily bleeding edge anymore, but the roadmaps to getting there. Really, that's the focus of a lot of inquiry on behalf of clinicians was, what does a roadmap to do this look like? There was a lot of discussion around human resource challenges, doctor fatigue, turnover, high turnover among not just clinicians, but other professionals, health IT professionals, nursing staff, et cetera. And how this is creating a real impediment to achieving goals around patient engagement and patient safety, consumer-centric healthcare delivery, and what are the IT-enabled tools that can be implemented to address that. Patients are becoming more savvy themselves in utilizing technology to manage their care, and they increasingly want more personalized care that features ease of use, accessibility, a broader range of choices, and full clarity on pricing. And then finally, sociological dynamics are increasingly factoring into data-driven efforts to enhance care delivery, and providers want solutions. Especially here in the U.S., they want solutions, and the folks overseas are paying very close attention to this. They want solutions that really capture and utilize these social elements. So with that, I'm happy to take your questions, and if there's any questions about the data or information on any of the previous slides, I'd be happy to scroll back to those and take whatever questions you may have. So I have a question here. The first one, do you have any information about, excuse me, how the vendors in your benchmark are doing in the UK? I did make some comments a few minutes ago about the UK market. And thank you for that question. Yeah, we have seen a handful of vendors winning new awards. Allscripts and Cerner come to mind. The recent finalization in the UK of the, I think it's called the Health System Support Framework by the NHS, really designed to speed up the process for NHS trusts to digitize. Kind of a mixed bag though across the vendor set that we track. As we've been looking at the data for the upcoming benchmark report, we've noted the UK has become a more lucrative market for some HITS vendors, although a more challenging market for others with, and those other vendors, without mentioning any names, are really starting to pay the price for not delivering, for not, for poor contract execution, for, for allowing whatever internal challenges, resource management challenges, or, the impact of large-scale mergers, whatever it might be that's impeding their contract performance. They're being called out on it, and the NHS has become much more savvy and much more cautious, and it seemed like they're looking more toward to the EHR-centric vendors for continued modernization efforts. I have a question here on the life sciences market. Do I see any signs that the bull market in life sciences will slow? Thank you for that question. Within our data set, we're not seeing any signs of that currently. All the current indicators suggest that data-driven drug development and platforms to enhance the integration or to better integrate the clinical research process are going to the level of that investment is going to be sustained at a fairly robust pace across the globe for the near term. And within the set of companies that we track, we expect many of them to continue to pivot their portfolios and towards that sector, as well as providing support for more vertical integration across not just the life sciences space, but life sciences with the provider and payer markets and government markets as well. And another question on any impact of the recent federal government shutdown. Not so much in the third calendar quarter. The 35-day partial shutdown certainly had some negative impact on IT outlays by federal agencies during the fourth calendar quarter. What I can recall from the comments made by the vendors that we track, Cerner and said that there was some impact, but not as much impact on their DoD or VA related work as well. I think this was consistent with their partners, at least with their partner Leidos, although Accenture did note some slowness in the sector and some cyclicals, just some seasonal, typical seasonal slowness in bookings. I have to assume that the shutdown did have some impact. Some of the other vendors that we follow noted that CGI, I think, comes to mind. They noted that they were redeploying people from federal projects to that were affected by the shutdown to projects that either weren't or just over to the commercial side of their business, just to keep those people on off the beach, so to speak, and fully utilized. I think what we're going to see in the upcoming quarter, when we arrive at the final analysis of our data, is that the shutdown did have an impact, but not as large an impact, probably because of the companies that we track. If we followed a larger slice of the companies, and that would entail following many smaller companies in the space, we would probably see a more acute impact on their revenue and growth. So I'm not seeing any additional questions at this time. Sarah, do we have any on your end?
Nope, I think that was all of them.
Okay, very good. So with that, if there are any additional questions or any follow-ups, my email address is there on screen. Feel free to contact me directly. And I thank you for joining us today. And Sarah, I will hand the call back to you.
Great, thanks. All right, everyone, please feel free to reach out to John with any follow-up questions. If you have a few moments, we would appreciate if you could fill out the survey on your screen. A replay version of the webcast will be available after the event and will be sent out to you via email. To view a list of our upcoming and past webinars, please visit tbri.com. Be sure to join us Wednesday, April 10th for a progress report, State of the NSB SDN Telecom Market. Thanks and have a great day.